Kids become orphans in Africa primarily through moms dying in childbirth. Moms can die in childbirth from labors lasting too long and then getting infections, babies being positioned wrong, just a multitude of things. And primarily, 90% of births are not attended by a doctor, midwife, or nurse, and it's even higher in rural areas, probably close to 100%. So problems aren't being caught in time to do something about them before disaster strikes. We first were introduced to Bora and the community on our first medical trip in November of '09, and one of our really good friends in Addis is the nephew of the chief of the community, and so we've established very strong relationships and with the whole community. And Bora is a mountainous community about 10,000 feet high, and there's very minimal access to health care. It's a 3-hour hike over 3 mountains to get to a hospital with one physician. So they have no access. They have many diseases, many problems, many moms dying. The village elders estimate that about 1 in 4 to 1 in 5 moms will die in childbirth. Moms are having about 10 to 15 kids, and the problems are there, and there's no solutions to these problems. Once DOMA saw the issues and established a relationship, the obvious solution was to build a health center here. The health center, the Hidota Health Center, means hope, a biblical version of hope, and this health center will provide maternal and child health care to reduce moms dying and improve children's life and their health status. But this piece of land is where the future health center will be for DOMA. We met with the elders over the summer. They gave us permission to use this land. They thought this would be the best place for it. They said it was flat, relatively flat, and it's accessible by 5 additional communities that are like in the surrounding areas. And there is some running water, sort of, just up the way. The health center will provide education, attend births, catch problems before they happen, do agricultural, gardening things. So it'll be a very holistic outlook and program for the community. We were asked to go to a hut down the mountain that a mom had just delivered a baby, her 6th baby, last night, in the middle of the night. So when I arrived, Mom was in bed with the baby, and Mom was having lots of stomach pain, excruciating stomach pain. And after I assessed her, I determined that she was very dehydrated. She had not drank any water in about 2 days, and she had the start of an infection. So I was able to give her some IV fluid and some antibiotics that will prevent the infection from occurring and hopefully save that mom's life.
Amber, who are you holding?
This is a brand new baby, just born yesterday, and they just told me that they're going to name her after me. So this would be baby Amber.
Of Bora.
Of Bora.
Bora.
Of Bora.
The one and the only.
One and only. Beautiful, look at her eyes.
Baby.